what makes smoking or even tobacco or I'd say nicotine so addictive?
So your brain has nicotinic receptors in your body. Once you're exposed to nicotine, your brain will crave for that. That is what is addiction. When your brain makes you do something, that is what is addiction. So your nicotinic receptor will keep you triggered for more amount of nicotine. Those nicotinic receptor, when they get nicotine, it binds to it. It releases dopamine, which causes all the stress relief and anxiety less psychosocial things which you have after inhaling or fixing on nicotine. So basically, since your body has your nicotinic receptors, it will keep on craving for that.
This is true for any major substance which causes addiction. I mean, be it nicotine, be it caffeine, be it anything else. Over time, it causes changes in the brain's nerves. It actually rewires your brain, so to speak, so that the same amount of nicotine would not be enough to give you your fix. It would slowly have to be raised up. It would slowly have to be increased. When you actually go in for any amount of nicotine, it causes your brain to become happy. Your brain releases happy chemicals. So you go on craving happy chemicals over and over. And each time when you go for it, you find that it's not as effective as last time. So each time you need to smoke more to get the same fix.
Any other methods that people can use to quit smoking?
So medical, we have gums, we have patches, we have lozenges, and we have prescribed medications like bupropion, varenicline. So we have lots of such medications, but I have seen with everything, it doesn't work at all. So the best part,
Long term.
yeah,
Long term, it doesn't
long
work.
term, it doesn't work. Yes, it will work for a period of time. Say after, I have not seen any person not going back to smoking after 6 months. Non-pharmacological way is very important because we have counselors, we have tobacco cessation clinics, we have psychologists where people sit and give them advice. Again, it depends on the willpower of the person, whether he wants to quit smoking or not. The willpower is the most important thing. If you can quit it cold turkey, but so these are only the options which are available here. In UK, in NHS, you go to a hospital, you have a e-cigarette shop inside the hospital premises.
The other things, the non-pharmacological methods, one of them, what I've heard, I've not tried it, but is hypnosis. There are some people who are using hypnosis to help people get off this addiction. I'm not sure how it works. I'm not sure how effective it is. But yes, that is also one thing that people have tried.
So in effect, it's not a one size fits all thing. You have these multiple options, choose whichever, or you combine them and you quit. That would be the ultimate aim.
Yes, the bottom line being quit. Try and quit burning tobacco or chewing tobacco for that matter.
Very briefly, you could tell us why vaping has such high success rates for people who want to quit smoking as compared to other options which are available?
People try NRTs. The half-life is very poor. The fix which you get from smoking a cigarette, that buzz which you get in your brain, which releases the dopamine, which causes the more of addiction. The half-life of NRTs are quite less, very less. So they do not get the satisfaction that they desire. Smoking is all about satisfaction. You smoke, your dopamine releases, it makes you hooked to it, but for a very short period of time. Then your nicotinic receptors crave for it more. That is when you light another cigarette. So what happens in NRT is that the half-life is extremely less. To reach that level of nicotine buzz, it takes a long period of time, which causes more of the relapse because the patient does not get satisfied. What you do in vaping is you were holding a e-cigarette which probably might look like a cigarette. You put it in your mouth, you inhale it, you blow the clouds, which typically mimics the action of a smoker. So for me, that is the reason people are getting their nicotine fix, and in an extremely less harmful way. So for me, that is more of the reason why relapses occur, and vaping is the best alternative in terms of other alternates for smoke cessation.